What are the risks or possible complications?
Some of this is predictable, and some of this is definable before surgery. But some of this is only really knowable in the surgery as the surgeon is doing the surgery, and how efficient the machines can be used to emulsify the lens and remove it. And also whether or not we use a laser-assisted surgery for this. But all of these things can be discussed and illuminated for you. But it's important that you realize that everything you read, everybody you talk to, they don't have your eye. Just because their surgery went a particular way doesn't mean your surgery will go that way. But in general, the surgery is successful 98 to 99% of the time. So when we say successful, what are the problems that can arise that make it not be successful? Most of the time, fortunately, those are very rare. Most of the things that occur just are delayed healing, but people still heal well. But they may not heal in a few days, it may be a few weeks or even a few months. The most common one of these is actually inflammation and some swelling in the retina called macular edema. This is more common in people with diabetes. This is treatable, but it does leave the vision somewhat blurry until that is resolved. That's really a result of the surgery, but not a complication of the surgery. And that's a result of the underlying health of you and your eye. The real complications, fortunately, are rare. These are infection, or what we call endophthalmitis. This, depending on which study you look at, is 1 in 10,000 surgeries. So that's extremely uncommon. Again, it's treatable, but it is a bad problem if we get that. Fortunately, that's statistically rare enough that most surgeons only have that happen 1 or 2 times in their entire surgical lifespan. For me, that's 37 years and about 53,000 surgeries, and I've had 2 or 3 patients with this, depending on the kind of surgery. So this is extremely rare. Second is bleeding in the eye. There is a chance of bleeding, particularly if you are on extensive blood thinners and have certain diseases. But again, this is 1 in 10,000. So this is a rare complication as well. The most common thing that actually can occur is if that capsule is not strong enough to go through the surgery. That capsule is what's holding your own lens. That's what we need to hold the new lens. Capsules can be weak. They can have inadequate support structure from the muscle. These supports are called zonules. This can also be seen preoperatively if you have this, and we can plan for that. But capsules may tear, rip, or rupture during this surgery. This may limit what kind of lens we can put in if we had been planning for a vision-correcting lens. Again, this can be anticipated, but you won't know until the surgery actually occurs if this occurs. Statistically, this is less than 1%. So again, this is an uncommon expectation, but not necessarily a complication of the surgery. We have a low rate of severe complications that you have to worry about. Keep that in mind as you review the literature that you're searching through.